So this is an instruction we're going to be showing you how to do an anterior dorsal adjustment. We're going to be using a device called a temper wedge. And a temper wedge is used to protect your hand, but it also increases the effectiveness of the adjustment. In order to adjust the patient, we also want to use a roll. And the patient's going to take their arms and they're going to wrap them around the roll. The right arm is going to go over the top. It's going to be right here on the shoulder. The left arm is going to go underneath. Then it's important that the elbows be as close to in line as possible. Now my hand that's going to be contacting here is going to span the gap across both of those elbows and bring them in together just in this nature. I'm going to position my body directly in front of the patient, and I'm going to bring the temper wedge behind on the segment I want to adjust. If I'm going to be adjusting the lower part of the spine, I'm going to bring the patient down a little bit. Just bend forward a little bit for me, please. I'm going to bring the arms down a little bit as well. Have them take a deep healing breath in, let it out. I'm going to come in with my chest and arm and push, just like that. Another deep healing breath in again. Now we move up just a little bit. Good. And we're going to move even up higher the spine. Take a deep healing breath in again there. All the way you go. There you go. Good job. Alrighty. And then we can just take the shoulders and stretch them back like that. And that's how we accomplish that adjustment. Once again, if we go through it again, the roll is placed in there in that manner. Right arm over the top, left arm underneath. This hand comes across, spanning both elbows. The temper wedge, if we're adjusting the lower part of the spine, we want to bring the arms down a little bit. As we move up the spine, we bring the arms up. And our force changes as well. My force is going through here lower when I'm adjusting here. My back foot is in line with the patient and where I'm lining the line of drive at. My shoulder's resting right up against him, and I'm taking all tissue pull out before I thrust, and I'm not letting any of that tissue pull off as I thrust. As I move up, we just continue to move that all the way up. And that's how it works. All right, and so that's how to do a proper anterior dorsal movement.